Hi guys, it's Dr. John Heyer again, and we're picking up where we left off last time with posture and the kinematic chain. And we were talking earlier about how everything works together and the weak link in the chain is the one that breaks under stress and duress, whether it's the head, neck, and the jaw, the spine itself, or even all the way down to the feet. So let's break this down into a little bit more of the biomechanics of the TMJ. When we look at TMD, there are two primary considerations that we need to think about. And the first one is that whether the problem is coming from the feet up to the head, or we refer to that as an ascending influence, or whether it's a head down to a feet problem, which we call a descending issue. So the best way that we can use to describe that is a couple of simple pyramids. I don't know how well you can see this, but bear with me here. We have a big inverted pyramid here, and we're going to use this as a representation of the hips, the pelvis, because that's the foundation for the spine. And this middle yellow pyramid is going to represent the thoracics, the shoulder, the core, the trunk of the body. This purple inverted pyramid is the green, that's the head. That's that big ballast we were talking about with the buildings. Remember when building sways this way, ballast goes that way, building sways this way, ballast goes that way. So we got this big bowling ball up here on top of our shoulders. And this little triangle inside is the lower jaw. And that can also act like a balance too, depending on where the head position is and where the jaw position is. Now, in an ideal world, everything would be lined up. I mean, can you imagine trying to balance these things in real life? That'd be like a magician's show all by itself. Everything's lined up. Chiropractors have an old saying: when the spine's in line, everything feels fine. So when everything is lined up, there's less stress, everything is working at its most efficient point, causing no pain. Everything's working the way it's supposed to. But what if something goes wrong? Okay, well now see the hips are shifted off to the left. And well, because of that, the shoulders shift off here to the right. And because the shoulders are shifting to the right, well now you got the head shifting to the left. Everybody's trying to keep a balancing act going here. And because of that, then now there's stress placed here on the jaw. So again, the question is it an ascending problem? Is it coming from the hip going up to the head? Or is there an issue at the head and the jaw affecting the pyramid going down? Well, that's what we need to figure out. But what I'd like to focus on now is how does the neck, how is the cervical spine, which is related to TMD at least 70% of the time, affecting the jaw? Well, here we have some drawings of the upper portion of the spine. C1 is the uppermost vertebrae, C2 is the second one underneath it, and C3 and 4, the third and fourth vertebrae underneath it. Now again, remember, there's a bowling ball sitting on top of this. The head weighs between 10 to 12 pounds. Depending on how much hot air you have inside, between 10 and 12 pounds. So the bowling ball sits up on top of these little tiny joints. And ideally, everything should be lining up nice and straight. Well, just like those pyramids can shift out of alignment, these vertebrae can shift out of alignment as well. So not only structurally can there be a misalignment, but you have to remember what lives in between these bones, and that is nerves. These nerves actually go up to the jaw and make a connection with other nerves that if there's compression in the neck, it can cause a person to feel like they have pain in their jaw. So sometimes you can actually have jaw pain and there's nothing wrong with the jaw. It's coming from the neck, or it's referred pain, and vice versa. So you may have been seeing a chiropractor for a neck problem when in fact you have a jaw problem. So if you have a jaw problem and it's referring pain to the neck, you may have been going to a chiropractor for a long time and it's not helping. Well, that's because you weren't looking at the whole big picture. Now, at this point, I'm going to pass it back over to Harry, Dr. Harry, and have him show what does he look at from a dental point of view. Come on over here. What does he look at from a dental point of view when he sees a patient sitting in the chair? Here you go.
Thanks, Dr. Hart.
All
nice
right.
to see you again.
Good seeing
How
you.
you folks doing? Nice to see you again. And happy you can follow up with us. What I'd like to do for 1 minute here is before we proceed to looking at the dental component and how it reflects the rest of the posture, I want to go back one slide and review very quickly what Dr. Heyer was just alluding to in regards to the C1, C2, and the atlas and axis, obviously. When we look at this right here, the base of the skull, which is this big bone right here, this is the back of the head. The nose would be somewhere out here. As we look at this schematic right here, these two areas right here are these lobes, is where the occipital bone actually comes and sits right here. Now the next thing to remember is exactly what Dr. Heyer mentioned, was these tight spaces which are allowing the string here, which is representative of the nerves. These nerves actually run in a very, very tight network, which is represented here through these foramina. So what ultimately happens is these both sit right on top of the other, and then on top of both of those, atlas and axis will sit base of occiput, what we call the base of the skull here. So the moral to the story, and what we really are concerned with, is when we have compensations taking place in the body, in the lower jaw, specifically in this case, we will have compensations and distortions that will take place in the head. These rotations manifest themselves as rotations in the vertebrae. And those vertebrae now will start imposing constrictions and pinching of nerves in the neck, as well as the jaw. So what we want to do right now is we want to go ahead and memorize this schematic and this symbol right here, because next time what we're going to do is we're going to talk about how the lower jaw causes these distortions to lead to chronic pain, and ultimately keep the bells and sirens in the head constantly on, and what we perceive ultimately to be then as pain. So stay tuned, and next time we'll have some good dental photos for you. Thank you.